Hi, welcome everybody to Yale New Haven Health's 2020 Virtual Cancer Survivorship Day. Today we'll be speaking about coping with fear of cancer recurrence. My name is Khairallah, and I'm the clinical social worker in the Yale Cancer Center Smilo Cancer Survivorship Program. And I'm here today with my colleague.
Hi everyone, my name is Jocelyn Walls. I'm the clinical social worker at the Smilo Cancer Center at Greenwich Hospital. Happy to be here.
Thank you, Jocelyn. Okay, we're going to go ahead and get started. Fear of cancer recurrence. So fear of cancer recurrence, or FCR, it's the fear, worry, or concern relating to the possibility that cancer will come back or even progress. It's one of the most commonly reported psychological problems experienced by cancer survivors, and it affects somewhere between 50 and 70% of cancer survivors across all cancer subtypes. Fear of cancer recurrence is common and normal to experience some level of that. I'm going to say that again. It's very common and normal to experience some level of fear of cancer recurrence. And with low levels, they may be adaptive and encourage positive health behaviors. Between 22 and 87% of cancer survivors report moderate to high levels, on average of 49%. And FCR is not strongly linked to prognosis and may even occur in individuals with relatively good prognosis. So who's most at risk for developing fear of cancer recurrence? Well, if you're a younger cancer survivor, have a higher subjective risk perception, more severe side effects, anxiety condition or a past mental health history prior to your cancer diagnosis, a past history of trauma, or maybe you have relatives who are developing or even dying from cancer. So fear of cancer recurrence, it really fluctuates on a continuum between functional and dysfunctional anxiety that can really impact all areas of life. And associations have been reported between FCR and psychological distress, sleep disturbances, and even poor concentration. And in extreme cases, they've been associated with the development of anxiety disorders, depression, and even post-traumatic stress disorder, or PTSD. So what does fear of cancer recurrence look like? Well, when we look at the mild form, cancer survivors may experience occasional thoughts about cancer with external triggers. So an external trigger could be coming to a follow-up appointment or hearing about a new cancer diagnosis among a family member or a friend, generating peaks of anxiety that will persist for a few days and then eventually resolve. Usually this improves over time, and overall the cancer survivor seems to be coping and managing well. When we look at the moderate to severe forms of fear of cancer recurrence, survivors may experience more frequent thoughts about cancer, perhaps more so once a week, or with the absence of a trigger, a perceived inability to control these thoughts, and a strong sense of distress that's associated with them. For survivors who experience severe and highly disabling FCR, this is approximately 7% of survivors. Survivors can experience constant intrusive thoughts, preoccupation that cancer will return regardless of the prognosis, may over-monitor for signs of cancer activity, have impairment in daily functioning, overuse the healthcare system for reassurance. You might be fearful or avoid screening or follow-up appointments with your medical providers, have unhelpful coping behaviors, and inability to plan for the future due to worry that your plans will be disrupted if cancer comes back or progresses. Constantly search online for information related to cancer treatment and prognosis, and these will be unlikely to remit or go away without some level of clinical intervention. So there was a study done by Goetz in 2019 who looked at 1,002 long-term cancer survivors across all cancer subtypes 5 years after their diagnosis, and they found that 17% of cancer survivors had high levels of FCR. They also found that there were higher levels of FCR in patients who had received hormone therapy. And even though FCR slightly decreases over time, it is still a common mental health problem for survivors even 10 years after their original diagnosis. FCR can last for many years, lead to quality of life limitations, and can also result in the development of mental disorders. So what do you do? Well, if you're a survivor or have a loved one who's a survivor who might be struggling with any level of fear of cancer recurrence, here are some helpful ideas to help cope. Make an appointment with a cancer center survivorship clinic. Speak with your cancer center clinical social worker or psycho-oncology provider. Obtain community mental health counseling or psychiatry. Attend a local cancer support group. Utilize reframing and refocusing on what is and isn't in your control. Exercise regularly, healthy eating, and hydration are all important. sleep hygiene, focusing on meaning and purpose in life, mindfulness, meditation, and yoga, and learning deep breathing, guided imagery, and stress management all can be helpful. Now I'll be turning the time over to Jocelyn, who will be further talking to you about some additional strategies that will help you with coping.
Thanks, Angela. So we're going to talk about effective interventions for managing distress and fear of cancer recurrence. We're going to talk about support groups, cognitive behavioral therapy, mindfulness, and meaning-centered psychotherapy. Since we only have a little time, these are really just going to be a little snapshot of these interventions, and if you can always speak with your social worker to get more information. Angela already mentioned that support groups are a great resource for cancer survivors. So I just wanted to take a moment to let you know that we have over 23 Smilo cancer support groups across all our care centers and at the main hospital. There are some specific groups for cancer survivors. So if you're interested in seeking out one of our support groups or one in the community, you should speak with your social worker. Cognitive behavioral therapy is another intervention that is very effective in working with cancer patients and survivors. It's CBT, as it's known, is based on the idea that how we think impacts how we feel. It's focused on challenging and changing unhelpful cognitive distortions and behaviors, improving emotional regulation, and most importantly, it's focused on the development of personal coping strategies that target solving current problems. It also focuses on changing maladaptive thinking, which will lead to changes in behavior and affect. So as I was saying, it's a very problem-focused and action-oriented form of therapy. So it's generally short-term and usually covered by insurance. Examples of some CBT interventions are journaling, cognitive restructuring, where we talk a little bit about some of those negative thoughts and try to redirect them. Best case, worst case scenario, where you can work with a therapist, play out some of these fears that you may be experiencing and see them through to help you get to the other side. And also mindfulness-based cognitive behavioral therapy. So to talk a little bit about mindfulness, mindfulness is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. That's a quote by Jon Kabat-Zinn, one of the founders of mindfulness. And it's helpful in these situations to break it down a little. So we'll go to the next slide. So mindfulness is paying attention, developing the capacity to intentionally witness our internal and external experiencing, including physical sensations, thoughts, and emotions, and what is happening around us. On purpose refers to cultivating capacity to sustain focus on a chosen object of attention, for example, your breath. And in the present moment is focusing on realizing that the present moment is where experience lives, as well as the opportunity for action. Types of mindfulness can include breath training, body scan, guided imagery, spiritual mindfulness prayer, mantra meditations, and mindful acceptance of thoughts and pain. While meditation is a type of mindfulness, mindfulness does not have to be through meditation. For example, we can apply mindfulness to our daily activities, such as eating or exercise. When you work to mindfully eat, you become aware of positive and nurturing opportunities available for food. You use your senses in choosing food that's both satisfying and nourishing. And you become more aware of your physical hunger and cues to guide decisions to begin and end eating. With mindful exercise, you may pay more attention to your bodies, your muscles, your pace and breathing, how you feel emotionally during your exercise. And research suggests that those who intentionally focus on the feeling of moving and deliberately take in their surroundings enjoy exercise a lot more. Of course, as I said, meditation is a type of mindfulness and very effective. Often, can be a great thing to start your day or do right before going to sleep. Here are a few apps that are mostly free or at least have a short-term trial-free option. Headspace, Calm, and Insight Timer are all apps you can download. And Cancer Care is a community organization, and while they're not a meditation app, they do have an app which has a meditation program that's specifically designed for cancer patients. So it could be a good fit. Now I'm going to hand it back to Angela to address meaning-centered psychotherapy for patients with cancer.
Hi, everybody. It's Angela again. So I'm just going to talk briefly about meaning-centered psychotherapy for patients with cancer. So meaning-centered psychotherapy for patients with cancer, or referred to as MCP, this is a form of psychotherapy that aims to decrease feelings of sadness or hopelessness by teaching patients how to focus on the importance of creating, experiencing, and keeping a sense of meaning in life. Dr. William Breitbart and his colleagues at Memorial Sloan Kettering, they were the ones that originally developed this back in 2000. They created and designed this treatment to be used with patients facing illness, and this can be done both individually as well as in groups. This form of psychotherapy is based on the work of Dr. Viktor Frankl, and particularly his book, Man's Search for Meaning. And so through their research on MCP, it's found to be very helpful for those who have cancer, as well as for those who are caring for cancer. And there's also research to show that even up to 6 months after a patient participates in MCP, they report decreased levels of stress, anxiety, and even depression. So if you're interested in MCP, what will you learn? Well, you learn to cope better by finding and creating a sense of meaning and purpose in life. You'll learn about sources of meaning and how it can be used to help you during your illness or beyond afterwards in survivorship, as well as new ways to face and overcome challenges caused by your cancer. So how does it work? Well, MCP is meant to help patients look for meaning in their past, present, and future, and in everyday life by teaching and answering questions together, homework assignments, and discussions with your clinician. MCP helps patients use meaning in life in order to gain a greater sense of meaning and purpose. MCP is often done in 7 to 8 sessions, but that may change based on the clinician and what they decide might work best for you or the group. So what will you talk about if you participate in MCP? Well, you'll talk about, why does meaning matter? What are some of the sources of meaning? Who are you before and after learning that you had cancer? What is your story? Putting the past, present, and future together. Your attitudes and how it can shape your cancer story. Living more through creativity, courage, and responsibility. How you connect through life, through love, nature, art, and humor. And your hopes for the future. So why would this be helpful to cancer survivors? Well, my work with cancer survivors over the years, it's really not uncommon when I'm speaking with survivors for you to express to me that after cancer and cancer treatment, you might feel lost, or you might report that your priorities have changed, or that you're wanting to be a part of something bigger than yourself. And so this would be a really good fit for survivors who express this. It's important to know that this MCP has been adapted and used with cancer survivors. And so by participating in this form of psychotherapy, you'll learn to explore your own identity and meaning and purpose in life. So if you're really interested in this form of counseling, please speak with your cancer center social worker for additional information, as we have several social workers throughout the system that are trained in this modality. And last but not least, this is an activity. And if we were in person, we would spend a little bit more time on this, but this is taken right out of the Meaning-Centered Psychotherapy Group Member Handbook. And this is an activity called Meaningful Moments. So I want you just to take a few moments and think about, you can close your eyes, or if you have a piece of paper, you can write it down. Just 1 or 2 experiences or moments in your life when you felt particularly alive, when life has felt particularly meaningful to you. This may be a very special event or a person in your life. It may be something very extreme and very elaborate and powerful, or something that's just simple and mundane. It could be something that helped you get through a very difficult time, or a time when you felt the most alive, or just a moment that just deeply touched you. So just take a few moments and reflect, and go ahead and write this down, or think about these meaningful moments. And by doing this, this is something that you can go back to, and it's something that can be very helpful, reflecting on the things that bring meaning to your life. And with that, I want to say thank you so much for this opportunity to speak with you today.
Thanks, everybody. As we said in the beginning, these are just a little bit of a snapshot of some interventions. We encourage you to reach out to your social worker to get more information.
Thanks. Have a great day. Bye.
Bye.